Anytime you have a virus like this that is so successful at transmitting between people, and that's through those large respiratory droplets, and also people can transmit when they don't even have signs or symptoms, you definitely want to make sure that you're keeping that distancing from people at least 6 feet. Sports, like any other activity, it's a very social event, and so people get together, they get in close proximity, and you're just more likely to have that transmission whenever you have that close contact and that many people together. We've known from past outbreaks that sporting events help spread disease. I wrote a paper about even cheerleading and mumps. It was a mumps outbreak, and it happened in a cheerleading event. So it's just the way sporting events are. It's not just about the event itself, it's about how you interact with people, and there's no sporting event that I can think of that doesn't have that element. In order to have these large gatherings, we're either going to have, I think, a vaccine so that we feel that people are going to be covered. Most people are going to be covered. They're not susceptible. They're not. They have some kind of level of immunity, or we're going to have to reach a point where enough people have been infected so that the few people who maybe haven't and are susceptible are still protected. Right now, if we start seeing a decline in cases, it's because we're putting in these social distancing measures and all these measures. If we were to just immediately resume our lives as they were, we could easily see another spike of cases. So we want to be really careful with that.